placed our IV catheter, we can talk about some of the complications associated with maintaining an IV catheter. First of all, we want to ensure that we've flushed our catheter with some heparinized saline, and that's usually about 1,000 units of heparin to a 250 or a 500 milliliter bottle of 0.9% saline and sodium chloride. And once we've done that, we know we've got a nice patent catheter, but still after we've done that, we want to flush the catheter at least once a day, make sure there's no resistance when we're injecting that, and also making sure that the patient's not reacting in any way that might tell us that that's uncomfortable, if the vein is blown, or if there's anything infectious going on. So one of our biggest concerns with an IV catheter, because it is an open door to a septic patient, because we're going right into the vein, any local infection there could become systemic really easily. So we're also checking for any redness, any sloughing of the skin, or certainly any discharge from the catheter site we'd be very concerned about and want to pull that catheter right away. Another thing we're checking for is any megapod or swelling around the IV catheter. Again, that could mean that the vein is blown, that there's some fluid leaking perivascularly. Also, we can see megapod if we tape the IV catheter too tight. So we're going to check that at least once a day to make sure that tape isn't too tight around the pod. And that's something that can happen if we have a patient who's severely dehydrated. Once we get that patient rehydrated, we might see that the tape has become too tight. That's pretty uncommon, but it can happen in a severely dehydrated patient. Another thing we want to be really careful about is watching for the patient trying to chew out their catheter. Frequently we can just put some vet wrap over it and the patient will leave it alone. Sometimes we can give the vet wrap a little bit of a lick deterrent. Bitter apple's a good example, but sometimes they actually have to wear an Elizabethan collar for the duration of the time they're going to have their indwelling catheter. And that's just so that they're not traumatizing the catheter site. And obviously, if we want them on fluids, they need to keep their catheter in. So I think we've addressed everything that could be a concern with an IV catheter. One other thing is phlebitis. So if we're feeling that vein and it feels kind of thick or ropey, that might mean that there is a clot within the catheter itself. Very uncomfortable, and probably that catheter wouldn't be patent much longer. So if that were something we'd see, we'd want to go ahead and pull that catheter right away. So those are just some of the things that can go wrong with the catheter that we want to watch out for: swelling, infection, megapod, and phlebitis are all potential complications of an IV catheter.